Every day, I make a difference in somebody's life.
In a hospital or a school.
Or in their home. I work with children.
And the elderly. And anyone in between.
In my job, I have to solve problems creatively.
I use both my mind and my body to help my patients adapt.
To heal.
To live their lives to their fullest.
I am not a hero.
But I work with heroes every day.
What is occupational therapy?
It's helping people learn to live again.
May 25th, 1998, I was on my motorcycle and a drunk driver hit me head on.
13 broken bones. I would say the majority of his 30 surgeries are on the one leg, but they also had surgeries on both hands, both shoulders, both hips.
And I suffered a closed head injury.
He doesn't remember names from one day to the next.
What I couldn't do right after the accident?
Yeah, right, I mean...
I was completely immobile.
He had to relearn to do everything over again. So in much of this he doesn't remember from his head injury.
Right.
But I had to dress him, I had to bathe him, I had to comb his hair and wash his hair and get him ready and actually physically take him and put him in the chair and take him to therapy every day. What they were able to accomplish with him in a short amount of time was a tremendous burden off of me. So once he was able to use his hands again, which is what the focus of his occupational therapy was, he was able then to be able to dress himself and feed himself and take care of all of those daily things that you take for granted.
The job of the occupational therapist is to come in and be sure that every aspect of a person's daily activity can be accomplished. The definition a lot of times for occupational therapy is the pursuit of purposeful activity. Strangely enough, occupational therapy, you hear the word occupation and you think about job. But occupational therapy is not about job. It's about another definition from Webster, which means to occupy time with an activity.
There's so many things I like about my profession. The biggest one is that I help people, that I see progress. They come in with a broken wrist that's healing, very little movement, a lot of swelling. They're painful, they're frustrated, they're angry, and within a week I can see an improvement.
In my experience, the type of personality of a person that would be suited for occupational therapy would have to be a people person, would have to be a fun, compassionate, caring person that is willing to get in what I call your bubble. Personal space. You have to be willing to get into somebody's personal space and be able to provide them the care that they need.
There's a lot of job opportunities. There's always job opportunities in the skilled nursing facilities. Hospitals hire occupational therapy assistants. There's outpatient.
You can work in different fields with different age groups. I've worked in the acute hospital setting. I've worked in a skilled nursing facility. I've worked in the school system.
Some of the long-term career options for OTA is they can take a few steps further to become occupational therapists.
Have gone into more of a marketing realm, again, or an administrative realm where they're head of a rehab department or in charge of a rehab facility.
I would recommend the OTA program at Lone Star Kingwood. Personally, because I was a prior student at Kingwood, and I feel like in my career I have just achieved and just soared to the highest of heights.
They're very enthusiastic about the program, and that's what's important. They go, they want to do the best for the students. They pull in the best teachers they can find, and they have the best opportunities when it comes to clinicals around the city.
I've learned a lot from the teachers. Sometimes you feel like they are working against you, but they are really helping you. They give you hard questions and hard scenarios to think about, but those are all the things that you have to deal with every day when you're at work.
Everything I've learned in school is now coming to fruition. And, you know, we're actually helping people get back to where they were before they had incident.
I would say somebody trying to get off into the medical field, into occupational therapy, it's a very, very good choice you're going to make. There's a lot of people out there that are going through problems, such as all the soldiers coming back from Iraq. We need more people in that field to come in and help. I really think so.
In the belief that all human beings are unique and have the potential to be realized,
I pledge myself to the conscientious and judicial practice of my profession.
I solemnly declare that I will hold and keep sacred
whatever I may learn of the lives of my clients,
seeking to serve and being cognizant of the need to maintain my competence.
I will strive to continue my professional growth.
To this end, that my work may be successful,
I will strive for greater knowledge, skill, and understanding
in this discharge of my duties.
It is with dignity and pride that I prepare to join my colleagues in occupational therapy.
And pledge myself to uphold the integrity of our profession.